My name is Jason Smith. I'm the Chief Medical Officer here at UofL Health. I'm also one of the trauma surgeons at the University of Louisville Hospital. And one of the most common questions we get, both from our website and emails, as well as call-ins, or just when I'm out rounding on the floors or taking trauma call, is what's going on with the masks? Why are we having to wear these masks? What are the most appropriate masks to wear? And why are we trying to preserve our equipment? So we're going to try and answer a few of those questions today. All right, let's start with the most common question I have is, what is an N95 mask? I think most of our frontline staff, the nurses and physicians, understand this, but many of the other people that work in our organization have that question. This is an N95 mask. It is very different than you see a surgical mask. It's got elastic around the outside. It actually has got a foam pad on the inside of the mask, and it's got a place to pinch the mask around your nose to hold a seal. That's the most important part of what this mask does, is it forms a seal against your face, and it filters out all of the air that you breathe in and breathe out through the pores and the filters inside the mask itself. That is what protects you from airborne viruses, and that is why when we have anyone who we are doing any type of procedures on that may have a coronavirus, if they are going to be coughing or sneezing, or if we're doing something that could make that airborne, that is why it's vitally important that our staff wear these masks. Unfortunately, this is also one of the areas across the country where we've seen a shortage of these masks. And it's why we're doing everything we can to hold on to these masks and using them appropriately for the patients that need them and in the situations they need them. So this is a surgical mask. They come in a lot of different shapes and colors and sizes, but the most important part about this is a simple cloth mask that usually fastens around your ears, or you can sometimes tie it behind your head. And this offers protection if you are coughing or sneezing, or your patient is coughing and sneezing. The idea is that the droplets that they would form would be caught on the mask and not go freely out into the air. Unfortunately, this mask doesn't protect you from airborne viruses if you're walking around Walmart or if you're walking around other places in the hospital without all of the other protective equipment that's required for isolation. One of the things we see is people running around the hospital wearing these masks, and I think it's important for them to understand that this is not really helpful to them, and it may take these masks away from people that need them on the front lines. Our nurses and physicians, our other caregivers in the hospital, when you use this mask in conjunction with face shields and gloves and gowns, you can get a good level of protection for caring for patients that have coronavirus. So it's one of the things that we are trying to do is limit these masks and the use of these masks outside of the clinical care areas. One of the other questions we get routinely is, what about homemade masks? So a couple of things about homemade masks. One is we absolutely appreciate the support of the community. Anyone who's producing those for us, they want to be involved in what we're doing to try and care for the community, and they're also trying to support you as healthcare workers. So we will accept the donations of those materials. What I will say is that they are not the first line choice in treatment or management of any of these symptoms. The CDC recommended that they be used as a measure of last resort if you are completely out of our personal protective equipment. I hope we never get to that situation, but we would accept the donations and hold on to them if we ever did. As of right now, we've got enough personal protective equipment for our staff that we want to use to protect them and protect themselves adequately. The cloth and homemade masks really aren't up to the standards that we would normally accept within the hospital for protection of our staff when they're taking care of patients. So that's why we haven't deployed any of those yet, but we certainly appreciate the community's support in this endeavor.